Welcome to the Confessions of a CRA podcast. I'm your host, Jasmyn Adams. I went from a struggling, aspiring CRA to landing my first CRA job with no monitoring experience or certification, and was able to fast track my career to a senior CRA making six figures in less than 2 years, and then on to multiple six figures plus a CRA coaching business. I teach aspiring CRAs how to attract and break into their first CRA position with no monitoring experience or certification and fast track their career using mindset and career development strategies. Now, let's dive all the way in. Hey y'all, welcome back to another episode of Confessions of a CRA. And I'm so happy that you guys have decided to join me again. I never take any of my listeners for granted, so thank you. Today we're going to be talking about how you can become a CRA with no monitoring experience or a CRA certification. Now, I've gotten a lot of questions in my DMs, in my emails, from people that I say this a lot in my social media, right? I say this a lot on LinkedIn, and even with my clients, when I do coaching calls, when people reach out, when I do sales calls, I talk about this a lot. And I'm starting to realize that even though you guys hear it, some of you may be hearing it for the first time, right? But for the ones that have heard it, have heard me say this often, even for you guys, I'm still not explaining it well enough, right? You still don't quite understand what I mean, how you can become a CRA with no monitoring experience or a CRA certification. It's like, what? I thought that was the requirements. Well, no, it's not. And today I want to talk about it with you guys. I want to get deeper. I want to explain more so that you can understand exactly what I mean. And then not only that, but you can walk away with the specific things, the specific steps that you actually need to take in order to land that first CRA job. So first of all, I want to share my own personal story with you guys and let you know, how I got into the industry and where I got started, which last week I kind of gave a general overview of my complete story. But specifically, I want to tell you about my first position and, did I have monitoring experience? Did I have a CRA certification? And the short answer to that is no, I did not. So my first CRA position was with arguably the number one CRO in the industry at the time. And I came in with experience as a clinical trial assistant, as a clinical research coordinator, as an in-house CRA. I even also had some drug safety experience. So I came in the industry with that basic level of clinical research experience and understanding, but I had zero monitoring experience. Yes, that's right. Zero monitoring experience. And I didn't really realize that. I say it all the time, right? And it's my life. So, of course, to me, it's like, yeah, I didn't have any monitoring experience. And just to put it out there, no monitor has monitoring experience before they become a monitor. There are those few instances where perhaps maybe they did an internship or something of that nature. Maybe they were an in-house CRA and they had that one opportunity, or those 2 or 3 opportunities where they were able to go out and co-monitor or something of that nature. But generally speaking, most monitors on average did not have any monitoring experience before becoming a CRA. So I'm not the exception to the rule. I'm not, just a one-off type of situation. This is typical. And so I had the coordinator experience, the CTA experience, the in-house CRA experience, the drug safety experience. I had all that experience, but like I said, absolutely no monitoring experience. And the actual job description for the job, the first CRA job that I received, said as a requirement that you needed 2 years of monitoring experience. That's literally verbatim what the job description had for the job that I actually not only was brought in for an interview, but ultimately received an offer and ultimately accepted the offer. And that was my first opportunity into the industry. So that, says a lot. Number one, obviously, you don't actually need monitoring experience to become a CRA. But then also for the people who see the job descriptions and they get discouraged and they hear people specifically, recruiters, hiring managers, people of that nature say, well, you need more experience. You need experience as a monitor. That's not exactly true. Maybe it might be applicable for that specific company and in that specific role, and that maybe they're hiring for a specific sponsor even, and that is what is required for that specific role. But even sometimes within the same company, depending on the department, because there are and again, depending on the company, let's just say for a large CRO, there are sides of the company where you work with multiple sponsors, multiple drug companies, multiple biotech companies, right? And then there's the side where there's a partnership and you will only work with that one sponsor or that one company. And maybe if you're on that partnership side, they have more strict requirements. So maybe that's the case for them. But within that same company, on the other side, where you're a part of the multiple service or the multi-service side, it might not have that same requirement. So that's where it gets a little bit tricky in the industry, in that it's so different across the board between companies, between the sponsor side, the CRO side, the site side, and then even within each company, there's still some differences. So long story short, don't get discouraged when you see 2 years of monitoring experience required. Now, in the same breath, don't get too ambitious and you have absolutely no experience whatsoever, and then you're only applying to senior CRA positions that say 5+ years of experience. That's the difference. So if you see the position and it says 5+ years and you have no experience, then yes, that position is not for you. But typically when you see, 2 years or less, and specifically when it's an entry-level CRA position or a CRA 1 position, then those are the positions that are for you aspiring CRAs. Those are for the people that are trying to break into that first CRA role. Regardless of if it says 2 years, 1 year of monitoring experience or not, those are the positions for you. So that's my story. I didn't have any monitoring experience when I landed that job. And then on top of that, I did not have a CRA certification. Now, after I landed my job and then on my second year of being a CRA, towards the end, I did sit for the ACRP CRA certification exam, and I did pass, and I did get my CRA certification through ACRP, which, by the way, is the only industry recognized CRA certification. And I don't want to make this episode about that, so maybe we'll cover that topic in another episode. But for all you people who reach out, for all you people who are wondering and asking about a CRA certification, number one, if it's not through ACRP, is not truly industry recognized. And number two, the only way you can sit for the exam and actually take it and even attempt to become certified is you have to be a CRA first. You have to have that monitoring experience for them to even approve you to sit for the exam. So now you can see why not only do you not need the CRA certification to become a CRA, but it's pretty much impossible, considering that you have to have a certain amount of hours actually monitoring and being a CRA and actually having work experience and those specific monitoring responsibilities and duties before you can even take the exam and even attempt to become certified. So again, no, you do not need monitoring experience to become a CRA. And you do not need a CRA certification to become a CRA. And quite frankly, it's pretty much impossible to even get that certification before you actually have that monitoring experience. So, like I said, I didn't have monitoring experience. I didn't have the CRA certification. And all of the colleagues that I know Of course, I don't know every CRA that ever existed in the world, right? But all of my friends, all of my colleagues, the same applies. They didn't have any monitoring experience. They didn't have a CRA certification. So, okay, I'm telling you, you don't need it. You don't need these things. Okay, that's cool and all right, Jasmyn. Okay, we don't need it. So what do we need? How do we get in? Right? That's probably what you're wondering. Okay. So let's talk about that then. What do you actually need in order to land that first CRA position? Well, number one, typically speaking, you need a bachelor's level degree. Now, there are some people that will argue with me on this, especially, I'm recording this episode, it's 2022. It's, right after we're still kind of in that COVID pandemic phase, but late pandemic phase. So things are kind of coming back to being, somewhat normalized anyways. But for the clinical research industry specifically, the industry's booming. Everybody's hiring. They're specifically looking for CRAs, and they are making a lot of exceptions. And even before this, people would argue with me, right? They would say, well, no, you don't absolutely need a bachelor's degree. And they're right. To a certain extent, it's not a 100% absolute requirement. However, I will add the caveat that, yes, you might be able to land. And I've recently even had someone reach out and say, hey, I got my CRA job and I don't have a bachelor's degree, but I was a study coordinator for a number of years. And it happens. It absolutely happens. It happened more often 10, 20 years ago, but today it still happens, honestly. But with the one caveat that your career will significantly be limited in terms of opportunities, simply because, yes, that one company might hire you. However, in terms of being promoted within the company, and if you plan to go higher and become, let's say, a CTL or a project manager or director, something along those lines, then that bachelor's degree will come into play yet again. And then if you try to switch companies and go to another company, that bachelor's degree may come into play yet again. So you might limit yourself in terms of how you can navigate the industry, how you can navigate that specific company, how you can navigate into other companies, and then on top of that, how you can leverage and negotiate for higher pay and for bonuses and opportunities of that nature. So instead of fighting the system and making it harder for yourself, I always say that it's much easier to just go ahead and get that bachelor's degree, especially in 2022, considering that there's so many schools out there where you can go online, you can do it on the weekends, you can do it in the evenings, you can take a few courses, 2 or 3 courses per semester while you're monitoring. If that's the case, if you've got that monitoring job, excellent. But I still would say, unless you want to limit your career and your opportunities or struggle and constantly fight against the system, I still say get it. So I'm gonna always say you need that bachelor's level degree. And then second, you need to have the right clinical research industry experience, the experience that the recruiters, the hiring managers will be looking for in entry-level candidates. And when I say experience, meaning the positions that will allow you to gain the skills specifically that they will be looking for. This podcast is sponsored by the CRA Solution. Are you an aspiring CRA struggling to get your foot in the door and land your first CRA position, almost ready to give up on your dream? Well, I have the perfect solution for your problem. The CRA Solution Mentorship, a 12-week online course and coaching program where you learn how to attract and break into your first CRA position with no monitoring experience or certification. After you go through this program, you'll no longer spend hours searching and applying to jobs because you'll have a proven job attraction system that consistently brings job opportunities directly to you via networking and LinkedIn. You'll also have a clear, thorough understanding of how to successfully brand and market yourself throughout your CRA job search, to strategically sell yourself, and land your CRA dream job offer without feeling lost or confused, wondering if you're on the right path. If you're ready to land your first CRA job, visit aspiringcra.com and book a one-on-one sales call today. So, and I don't want to go into depth on those specific skills in this particular episode. So we'll cover those, in a later episode in a lot more detail. But just to kind of give you an idea of, generally speaking, what roles and what types of skills, experience they're going to be looking for. So you guys already know I always hit those top 3 paths to the CRA position. And that's going to always be the study coordinator role, the CTA, clinical trial assistant role, and or the in-house CRA positions. Those 3 positions are the best paths to becoming a CRA. So if you're an aspiring CRA and you're just graduating from college, or you're just, transitioning from a different industry, or you're just venturing out, I would highly, strongly recommend that you seek out and start targeting one of those 3 positions. But if you're already in the industry, and let's say you have drug safety experience, or you have study startup experience, or something of that nature, project coordinator experience, don't feel bad. That experience is just as good. That experience is great. It's excellent. It still gives you what I'm about to cover in terms of the skills. When I say the right experience, the skills that they'll be looking for. So that experience definitely still qualifies. I just have what I call the top 3, the primary gateway roles that recruiters and hiring managers specifically look for in entry-level candidates. And why do I point out those specific roles? Because they give you the most chances and opportunities to gain the skills that they will specifically be looking for. And those skills include TMF, ISF, and essential document experience, EDC, or electronic data capture experience, for those who don't know what EDC is. So data entry, query, and DCF, or data clarification form resolution. They're looking for that type of experience. They're looking for patient interaction and subject visit experience. They're looking for experience in adverse events and serious adverse events. They're looking for ICF, informed consent experience, and then experience in the consenting process as well. They're looking for ICH GCP, ALCOA, CCEA, good documentation practices, and HIPAA compliance experience. They're also looking for IP accountability and inventory experience, as well as experience using IVRS and IWRS. They're looking for CTMS experience, EMR and source documentation experience, and then experience in collecting, processing, or shipping lab samples. So all of the things that I just named are the types of specific skills, experience that I am referring to when I say the right experience. And then the 3 primary gateway roles that I mentioned are the top roles that will give you the most experience. Typically speaking, of course, not across the board and in every single company, but typically speaking, those are the jobs that will give you the most opportunity to gain experience in as many of those areas that I just listed. So for example, if you were a data entry coordinator, you may only be able to have an opportunity to have the EDC experience, where you're entering the data, answering queries, maybe some DCF resolution. Let's say you're a regulatory coordinator. You may only be able to get experience in the TMF and or ISF and essential documents area. However, if you had one of the primary gateway roles, you may be able to get experience in 5 or 6 of the things that I just listed. So that's why I capture them, and I've coined them as the primary gateway roles, because you want to try to gain as much as experience as possible. You want to be able to check off on that list that I just gave you guys. You want to be able to check off as many of those things as possible when going into your first CRA role. And not just so you can land the job, right, either, but so you can actually be a successful, thriving CRA. So many people just want to hurry up and they want to get their first CRA job and they want to be a monitor, right? They feel like, I have a degree, I have a bachelor's degree. Some people, I have a master's degree, I have an MD, right? I have a PhD. They have all these degrees. I got this certification, I got this training. They feel like they've done all these things but they don't have any industry experience. And jumping into that first CRA role, I will tell you, it can be very scary. And if you aren't scared, that in and of itself, if you don't have any type of anxiety or any type of worry or doubts or fears around it, that in and of itself lets me know that perhaps you haven't done enough research or homework about the role, and perhaps you don't have enough industry experience, because there should be some type of, not to say that you should be terrified, right? But you should be, it shouldn't be a level of like arrogance, like I know I can do this because, I have this degree and that degree and this training and this certification. Like, it shouldn't be that overwhelming level of arrogance. Of course, you want to be confident. You should be confident. But it shouldn't be confidence that has turned into arrogance as to where you feel like the industry somewhat owes you something because, you're the best thing that happens, right? And so I just want to caution you guys that are just so gung-ho and so ready to land that first role that you need to enter with caution and not be so, quick to say, I could do this, I could be a CRA, I don't need to be a study coordinator, I don't need to be a CTA, because not only will those positions help you land the job, but they will also help better prepare you for the job. Yes, in these entry-level training roles, you will get training. You'll get on-the-job training, yes. But that on-the-job training is very brief for the most part, and it's nothing in comparison to actually being a CTA or a study coordinator for, a considerable amount of time. So going back to that list of what you actually need. So number one, I said the bachelor's level degree. Number two, I said you need the right clinical research industry experience. And then number three, you need GCP training or GCP certification or some type of GCP working knowledge. So there are several places, if you don't have this type of training or experience, that you can go to. I always recommend City Training, and that's CITI. They have a very good GCP training. And then also GCP Findings. They have a GCP training that's actually free, and it's really good, and you can take a quiz and get a certificate and everything at the end. But you want to have some type of either GCP training or GCP knowledge. The best is GCP working knowledge. And of course, you can only get working knowledge if you have actually held a position, held that job, and been able to work and gain that knowledge. And then the fourth thing I would say is that you need to have a burning desire to actually become a CRA and know this career path, know that it's for you, and then believing in yourself and your ability to actually achieve this dream. So a lot of people say they want to be a CRA, but then when I ask, it's very basic, generic. I want to travel. I want to make a lot of money. They don't really know a lot of detail about the position, and they can't go any further, any deeper, any more thorough than that basic surface level generic answer. So you need to know that you 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 want to become a CRA, that this is for you. And not only that, that you believe that you can do this job, that you can get this job. So I always say that would be the fourth thing that you need. I always recommend that. Do people actually become CRAs who don't even really know they want to be a CRA, or that they weren't even looking to become a CRA? Yes, it happens. I'm not saying it's impossible. But again, I also not only want to tell you guys what you need to become a CRA, but my goal for everybody is that they become successful, thriving CRAs. So that's my recommendation. And then the fifth and last thing that I always recommend is the knowledge and the skills to position yourself in the best way that clearly tells your unique story, that clearly attracts the right attention, and then that successfully sells your unique value proposition. And how do you do this? It gets very deep, right? This is what my entire coaching program focuses on, for the most part anyways, in addition to mindset strategies. But this is what my entire coaching program focuses on, because again, I don't want to just help you get a job. I focus on providing you with that complete life-changing transformation. And in order to be able to do these things, you have to focus on personal branding and marketing. You have to focus on crafting a resume that truly tells your unique story. The same thing with your cover letter. You have to create a LinkedIn profile that becomes your job job attraction system. You have to use job search strategies that takes the search out of job search and again focuses on attracting jobs. The same thing for interviewing. You have to take that and turn that into an opportunity to sell yourself, but in a natural, organic way that is truly just a conversation. And that's what I focus on. And these are the things that will help you land those positions, not only get the interviews, but land those positions. And like I said, this episode is not about going into details and focusing on those things. So I'll cover that in another episode as well. But these are the 5 things that you actually need to land your first CRA job. Again, number 1, bachelor's level degree. Number 2, have the right clinical research industry experience. Number 3, some type of GCP training, certification, working knowledge. Number 4, having that burning desire to become a CRA and that belief in yourself and your ability to actually land a CRA position. And then number 5, the knowledge and the skills to position yourself in the best way that articulates your story, attracts the right attention, and successfully sells your unique proposition and value. So those are the 5 things that you actually need. Of course, somebody may argue with me, right? But that's based upon my own personal experience, the experience of my colleagues, and the experience of my clients. Exactly what I've seen in the industry, exactly what I've seen, not even just back when I applied, but today with my clients today. So in the next few weeks, we're going to go deeper, right? I said I didn't want to go too deep today in some of those areas, but in the next few weeks, we're going to go deeper. We're going to talk more about those specific types of experience that I mentioned. We're going to talk more about some other roles outside of the primary gateway roles. I want to talk to you guys about some of the secondary gateway roles. I want to go more in depth about each area of experience that I listed, right? And more detail about where and specifically how you can get that experience. And then, of course, I want to go into more detail about how to properly position, how to successfully position yourself, because that's really the main thing. Nobody wants to think of job searching and job applications and the job hunt process as selling themselves. Nobody wants to think of themselves as a service or a commodity. They feel like it takes the human essence out of the process. But the reality is, if you want to successfully land your dream job, you have to change your thinking. And that's what it boils down to. It becomes a matter of, do you want to win this game? And if you do, here's how. Here's the playbook of how you win this game. And part of winning that game is learning how to sell yourself. You need to learn how to brand and market yourself. And so in the next coming weeks, like I said, we'll go more in depth on all these things. I want you guys to be prepared. I want you guys to be successful. And I want you guys to know exactly, specifically what I'm talking about when you see me out here on LinkedIn and when you see me on these other platforms. I want to get into more detail and help you guys understand exactly what I mean. So please DM me on LinkedIn if you have any questions or topics that you want me to cover. The things that I cover in these solo episodes are just for you. So let me know exactly what you want me to hear so I can make sure that I answer your questions and cover your specific topics. Thanks for joining me today, and I can't wait to share what I have for you in the next few weeks. Thanks for hanging out with me. You are now one step closer to hitting your career goals. And if you are an aspiring CRA who wants to take this work further, come work with me inside of my coaching program. You can go visit aspiringcra.com to learn all about it. If you're looking for more inspiration, check out Jasmyn Adams' Aspiring CRA TV on YouTube. And come follow me at Jasmyn Adams or the CRA Solution on LinkedIn. You can also check me out over on Instagram at the CRA Solution. And hey, if you like what you hear, don't forget to follow this podcast and make sure that you download, rate, and review this episode.